22. I currently live in Perth, but my hometown is in Broome. I have a condition called chronic fatigue syndrome. So it means I have a fairly compromised immune system. My health isn't that great, so I have to spend a lot of time indoors. I have a lot of symptoms like fatigue, compromised immune system. I struggle with problems with my heart because of the disease. I currently am living with my mum, so she does fly in, fly out work. So she's home some of the time. The rest of the time, I am by myself. Then I have a few friends and extended family that help support me. I am personally planning to get the vaccine when I'm eligible to do so. There's a few reasons as to why. The first reason is because of the chronic fatigue syndrome that I experience. I don't want to compromise my immune system anymore. Getting COVID would probably not be very great for me in my current state. I also would really like to go back and visit Broome at some point. That's my hometown. There's a lot of small communities that I would like to not see COVID affect at all. So I want to make sure I'm fully vaccinated before I return home. I don't want to be putting my hometown and my community at risk at all. My greatest concern with COVID is long COVID. So not only what happens after you get COVID and when you have it, but the long-term side effects. A lot of people are experiencing things like fatigue, shortness of breath, muscle pain in the long term. And that's something that I already experienced with chronic fatigue syndrome. So I don't want those symptoms worsening for myself. I think the community in Broome hasn't been particularly affected by COVID. So I think it at times is a little bit harder to get a bit of a grip on the situation. I think having a look at what's going on in places like Sydney at the moment, I think it's starting to become a little bit more real. And the fact that this can spread so easily. So I think my friends and family in Broome are probably starting to now realize how serious this can be. I feel ready to get my vaccine. I think it's been a long time coming. I mean, there's obviously a little bit of nerves. I'm not one to like needles too much, but I think I'm excited to have it done. I think the pandemic has fairly significantly had to change young people's lives. Obviously, we can't see our friends and family face to face to the extent we could before. I think for a lot of young people as well, there's a few like concerns about the lack of travel young people have been able to do. I think that's a bit of a rite of passage that's felt a bit of a disconnect recently. I think also with the new strains, there's a bit of concern since they're affecting young people quite a lot. If people want to get vaccinated, they should check the Department of Health's eligibility checker to book in.